Hi, my name is Penny Blake, and I work in the Children's Emergency Department at St. Mary's Medical Center, part of the Palm Beach Health Network. Despite the fact that my mother and both of my aunts were nurses, and one of them was a lieutenant colonel in the Air Force, I never really felt a desire to go into nursing. My first year in college, my roommates were nurses, and as I started listening to them and hearing what they were saying about what they had done each day, I came to realize that this sounded like something I really wanted to do in order to be able to help people. 4.5 years ago, after all the years that I've been in nursing, I had the opportunity to come and work in the Children's Emergency Department at St. Mary's Medical Center, which is something that I've always wanted to do, to work with children in the emergency department. What I love the most about my job is the fact that I get to come in and get sloppy kisses from babies and hugs from toddlers, and I help to get them to feel better. I also work with a wonderful group of healthcare workers and co-workers. We're like a big family, and we help hold each other up and support each other through the good times and the bad times. And we have a lot of fun, because that's what you do whenever you work in a children's hospital, is you have a lot of fun, because most of us like to cater to that inner child within us. One of the things that I'm going to remember the most during this period of time is I helped to deliver a baby out in the parking lot. I was sitting at the screening desk. People came rushing in saying, "Someone's having a baby." I went running out. We delivered the baby in the person's car, and we had a whole crowd of people around us who started cheering whenever I was able to do what I knew to do in order to get the baby to start breathing and crying again. We rushed the baby and the mother upstairs to the OB unit, and the last I heard, both were doing very well. As a healthcare worker, I've seen a lot of things that have gone on throughout the years. As members of our community, you can help us prevent the spread of coronavirus. Wash your hands, wear masks, maintain 6-foot distancing in social instances whenever you're around people. But if you do get sick, we here at St. Mary's Medical Center are prepared to take care of you and help protect you from the virus as well. We are using enhanced cleaning with our housekeeping department. Our staff is wearing PPE, and we have separate areas for treatment for those who have coronavirus away from the main population of the hospital. We want you to stay safe, but we also don't want you to delay care, because that could mean a difference for you and in your health situation. In the 43 years that I've been a nurse, I've been through AIDS, I've been through Ebola, and I think that this is probably the biggest challenge that we've ever seen or had. We can make it through it because there is a light at the end of this tunnel, and it's shining on the resolve of my coworkers and those of us in healthcare who are determined to beat this virus.